have been trying to get something that looks something like this and that would deal with our population more effectively in terms of health needs since 1948. And so, you know, I happened to be there for 3.5 years during the Clinton administration. We tried to make it into something that people could get their arms around. The Obama administration had more support. I think people had been educated to some extent, understood more.
And I think this is true of all the new things we create, including the Department of Homeland Security. The public's expectation is when you come into existence, they expect you to be fully operational.
His words resonated in my ears about the vision and the people perishing. And so that drew me to public service. And I'm very, very grateful that I've had a great career in public service. It's not over yet. I have many more years to go, but I've enjoyed every bit of it.
Healthcare. If you have a minimum wage job that doesn't provide health care, what happens to you and your family? If you don't provide preventive care, down the line, the rest of us are going to have to pay for it in catastrophic cost. So designing programs in that vein that truly address what the needs are for families that are working and that are poor. And the bottom line is finding ways to create wealth in families so that they can be self-sustaining. And that is very difficult and tricky in the environment where we think of individuals being responsible for themselves, and when we think of democracy often as being reflective only of people voting and not of them taking some responsibility to help do the public's work.